I set up Rejuvenate Medical with my colleague because there really was a lack of centres in the UK offering whole body red light therapy. And I see red light therapy as a really useful tool for treating so many problems, but also for patients who want health and wellness benefits from red light therapy. The other things that I do in functional medicine bolt on very nicely to the red light therapy that we're offering. I also do some important work with Alzheimer's patients, and I'm a registered Bredesen practitioner for patients with Alzheimer's disease who want to follow the Bredesen protocol. So the Bredesen protocol is a holistic dietary and lifestyle program for patients with cognitive decline from Alzheimer's disease or dementia. What it does is to try and find any of the root causes to their problem, whether it be a metabolic problem, a nutritional imbalance, an issue with toxicity from a heavy metal, whether their blood sugar is all over the place, their insulin control is over the place, their hormones are out of whack, and it tries to correct and address as many of these problems using natural methods to try and get leverage over their condition. So my success rates are very similar to Dr. Bredesen's research papers, which seem to demonstrate a 70% improvement in patients' cognitive function who follow the protocol. Patients usually come to me with a diagnosis of cognitive decline or Alzheimer's disease because they've already been through the sort of standard NHS workup. They've noticed symptoms, they've realised their memory or their cognition is not functioning well, they've been given the diagnosis, but that really is where the NHS kind of ends. Short of the dementia drugs, there's very little that can be offered to these patients in the conventional medical world. Believe it or not, Alzheimer's can be reversed using this approach. We have, up until this point, always been told that this is an irreversible disease and the only way is down. But we now know from this program that this condition can be reversed. At the very least, we would hope that we can halt this condition in its tracks and not see any further deterioration in those patients who start the program. But for some who we catch early, we have been able to show that we can reverse this condition. And we've proven it on cognitive testing, and even changes on radiological imaging have been demonstrated by doing this protocol. So it is now possible to reverse Alzheimer's.